After the surgical procedure, no stretches are to be initiated for a full 24 hours. At the 24-hour mark, start the stretches. The technique and details for the stretches to achieve optimal results are very specific and should be approached seriously with a focused attention. To achieve optimal results and not risk the need for a secondary procedure, the goal is to guide the tissues through proper stretches without long lapses of time to heal in a way that maximizes movements in all planes of motion that ultimately affects functional motions. This may mean episodic periods of sleep interruption to allow for a brief stretch. Approach your baby from behind so that the vectors of motion will be upward and back. If you approach the baby from the front, there will be a tendency to push down on the baby's jaw and even the tongue, causing a gag reflex. Cradle the head with your thumb and ring fingers so that you are not trying to move or stretch a moving target. Your motions should not be haphazard. Look at what you are doing, do not do it blindly. The middle finger can be used to push down on the chin to initiate a jaw-opening response. The other parent giver can also help by putting downward pressure on the chin to encourage your infant to open their mouth. The exercises are 3 components: elevation, roll, and sweep. With the elevation, the index fingers will dive under the tongue, left and right, coming together near the base of the tongue, where you will then push back and scoop upwards towards the palate so that the full diamond is visible without a midline crease. Then hold for a slow count of 6 to 7 seconds. Count slowly. We are making sure that the surgical diamond is open and not collapsed and folded upon itself. We also want to make sure that the tip of the tongue is guided up towards the palate. With the rolls, remember that the finger is in contact with the room with a roll motion moving upwards like a rolling pin when you flatten the pie dough. Tension is applied on the room. Do not rush the roll. Repeat twice. Roll with tension. Roll with tension. This would be an example of a rush tension. As you do this, the diamond will take on an elevated, narrow appearance with no midline crease. Do not allow the mandible to rise up and down, because this causes a diminished tension on the elevating stretch force. This would be an example of a midline crease. With the sweeps, again, you are in contact with the wound, moving from side to side slowly. Repeat twice. This would be a rush sweep. Stretches are done 4 times a day, every 6 hours initially. Then as the healing progresses, we will titrate down to 3 times a day, every 8 hours, and then 2 times a day, every 12 hours, then 1 time per day, every 24 hours, and if necessary, every other day. Everyone heals differently, and the wound size depth is different depending upon the tethered tissue and its thickness. The tissue appearance and functionality dictate when we progress in the protocol. There is no specific time when the changes occur, but basically the aftercare is about 4 to 5 weeks. If the stretches are inadequate in the beginning, we often need to add time towards the end to counter the re-adhesion. There may be exercises, stretches required of you by your IBCLC, OT, speech therapist, chiropractor, physical therapist, myofunctional therapist that you do in addition to our stretches, and they'll be on a different time frame frequency. Heavy drooling or salivation is not unusual after surgery in the mouth. This is a normal response to a wound in the mouth. Saliva has antibacterial and antifungal properties. A baby's crying during the stretches is not unusual. It is their way to express their dislike for their normal eat and sleep lifestyle. Causing an occasional small bleed during the stretches is not unusual. Remember, if the wound has started to close since the last stretch, and we are disrupting that, a minor bleed may occur. Pressure with gauze or a Q-tip dipped in cold water for 15 to 20 seconds works effectively. Do not blot the area. Once we have reached the maturation stage in the healing process of the surgical site, the wound has essentially closed. The tissue harbor is still maturing and strengthening. Active wound management is essential over the continuity of the exercises to improve the infant's muscular stamina and strength. A new skill set is being established, and there is a retraining or relearning of the new neuromuscular patterns.